Dr. Shannon Clark here. I am a double board certified OBGYN and maternal fetal medicine specialist, and I want to talk about headache and pregnancy. And the reason why I'm doing this video is because of what happened with Adriana Smith. She is the pregnant individual out of Georgia who went in at 9 weeks of pregnancy because of headache. Don't know her pregnancy history, don't know if this is the first time she had headache. All I know, she went in for a headache. She was seen, got worked up. I don't know what that workup was. I don't think that she got head imaging, but then she was sent home. By the next morning, she was taken back to the hospital because she was unresponsive and was found to have, the media reports, blood clots on the brain, and was subsequently declared to be brain dead. So let's go through some important things you, as a pregnant individual or soon-to-be pregnant individual, need to know about headache. First thing is this: if you have a history of having headaches, it is important to let your obstetrical care provider know and have that documented, knowing what kind of headaches they were, if you were ever diagnosed with a certain type of headache like migraines, what medications you've taken in the past, how often you have these headaches, and if they seem to get better or worse with pregnancy. It's also important to discuss with your provider what your headaches are typically like, because that will help in the event that you have headache in the future in your pregnancy to differentiate if it's something that's pre-existing or if it's something new. I want to move in a second, but I want you to look at this list of certain symptoms that you might have with your headache that would indicate or could indicate that there's actually something serious going on. Pause to read. If you have any of these things, go to be seen ASAP. Now, the good thing is that most pregnant individuals with what's called primary headache syndromes have been diagnosed before pregnancy, like I talked about before. And those include tension type headaches, migraines, and cluster headaches. So if you're having a headache, it's important to be seen to make sure it's not something different than one of those three things, and also to make sure it's not preeclampsia. So if you're having these types of headaches or they're a little bit different than what you typically have and you're after 20 weeks, you gotta be ruled out for preeclampsia. Now, if you're pregnant and you have new onset of headache, you've never had headaches before, or it's a headache that's different than what you've experienced in the past, and preeclampsia has been ruled out, then half of you will have migraines and the other half will have one of these. Pause to read. Now, if you have a new onset of headache or atypical headaches for you, then the approach to figuring out what's going on is pretty much the same as if you're not pregnant. And here is an awesome algorithm here from Up to Date on the evaluation of the adult with new non-traumatic headache. Pause to read. Now, I will close by saying I have zero problem consulting neurology when it comes to headache. I don't want to miss anything. I take headaches and pregnancy very, very seriously.